5B, USN 1BM 18CS072. Today I'm going to talk about COVID-19, stats about COVID-19, signs and symptoms, and handling of a patient during COVID-19, and precautions the patient must take to avoid transmission. How can we identify the disease? What is the global situation around the disease? So let's go. We cannot say this loudly enough, or clearly enough, or often enough. All countries can still change the course of the pandemic. Statement by Dr. Tedros Adhanom Ghebreyesus, World Health Organization's Director General. Introduction. COVID-19 is an infectious disease caused by recently found virus known as SARS-CoV-2 or novel coronavirus. Before the outbreak originated in Wuhan, China, or December 2019, there was no information about this virus. Now it is a pandemic. 213 countries have been affected by the disease up till now. Transmission occurs mainly via respiratory route. History. The oldest common ancestor of coronavirus has been dated as far back as 9th century BC. Some studies published in 1990 specified the most recent common ancestors as follows: Beta coronavirus 3300 BC, Delta coronavirus 3000 BC, Gamma coronavirus 2800 BC, Alpha coronavirus 2400 BC. About coronavirus. Symptoms of COVID-19 include high fever. The temperature can exceed 37.3 degrees Celsius to 99 Fahrenheit degrees. There could be tiredness of the body feels numb, your taste can go, your taste buds would be numb, and you will always feel drained to perform like various tasks throughout your day. And there could be dry cough, irritation, and constant irritation in the respiratory tract, along with excess of mucus. All right. How does coronavirus gets transmitted? So, how does it get transmitted through people? This disease can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or exhales. It can also spread to surfaces. Because these small droplets land on surfaces, which means any person that touches the surfaces and their eyes, nose, or mouth can become infected. Yes. Now, what about asymptomatic people? What are these asymptomatic people? Like, these are people those who get COVID-19 but don't show the symptoms of COVID-19, and these are the people who are basically active spreaders because we cannot detect COVID-19 early in them. So many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease, that you can still catch the disease from an infected person who only has a mere cough and does not feel ill. So this is important news. Infographics about COVID-19. Yeah, tiredness. The body feels completely tired, without energy. A high fever. There could be a high fever of around 37.3 degrees Celsius. And of course, a very common symptom is difficulty in breathing. Breathing actually feels very much more difficult. Dry cough, constant coughing without exhaling any mucus. What to do if you have symptoms? Step 1, you have symptoms or have been in an infected area or had a contact with COVID-19 patient. Step 3, you will get specific instruction to what to do and what not to do. Step 2, call the designated personnel such as doctor or a healthcare worker. Step 4, send samples for PCR test. Step 5, according to the test results, you will get instructions. About 80% of people recover from this disease without needing special treatment. Stats about coronavirus. Mortality rate by age. So clearly through this graph we can see that the people who have higher age are more vulnerable to the virus and have more chances of getting infected, and this death rate clearly shows that. But even youth should be very um, conscious of the virus, because there are some deaths in youths also, so they cannot take it lightly. So yeah, this is about the mortality rate by age. Global numerical data: 7 million 930,989 cases are reported in world as of June 2020. Now the cases have even increased, and global death rate is 3.4% overall, which is not a small figure given the world's population. These are the worldwide deaths, and these are the worldwide recoveries, which is encouraging, but still we are fighting the virus. These are stats by some Sri Lanka stats actually. These are 5 countries in June with highest number of COVID-19 cases. The first being USA, second being Brazil, third being Russia, fourth being India, and the last being United Kingdom. Signs and symptoms of COVID-19. Well, we can categorize them as follows: respiratory systems, fever, cough, sore throat, shortness of breath, breathing difficulties. In severe cases, pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Incubation period 2 to 14 days, and we have to be particularly careful when we have traveled recently to some of the major countries which have shown signs of the virus, like USA, Europe, Iran, South Korea, India. Healthcare workers who have been working in patients with severe acute respiratory infections, person develop an unusual or unexpected clinical course, close physical contact with a confirmed case of COVID-19 infection. Investigation, mainly RT-PCR. Criteria for testing: the person who are arrival from high risk country of for COVID-19, working in severe acute respiratory infection environment, close contact with a confirmed or probable case of COVID-19 infection. Type of sample: respiratory sample. So these are some scientific names which I will not take, but this is how the swabs are taken, and these are the scientific name for the swab, and these must be taken in order to give a good test result. Tissue for biospy or autospy, including from lungs, could also be taken. Sample storage: the sample must be stored at about 4 degrees Celsius, like not more than 8 degrees Celsius at least. If any delay is there, the sample could be useless. Sample transport: sample collect to VTM tubes, viral transport medium, and transport to laboratory within 48 hours. Infection controls: restrictions of travel, overseas, local, standard precaution for any patient with suspected infection with COVID-19. Suspected patient wearing a surgical mask, keep the patient in separate area, maintain at least 1 meter distance each patient. Triage and waiting areas are educated, ventilated. Hand hygiene: respiratory hygiene and cough etiquette, use appropriate PPE, prevention of needle sticks, sharp injuries, cleaning and disinfection of the environment with routine disinfectant, droplet precautions, use a surgical mask of working within 1 meters of the patient, place the patient in single room, limit patient movement. How can you reduce the risk of COVID-19 infection? Well, you can wash your hands regularly with soap, cover your mouth and nose when coughing or sneezing, thoroughly cook meat and eggs, if you eat them, that is. Avoid contact with anyone showing flu-like symptoms. Avoid unprotected contact with live, wild, or farm animals, because it has been proved that COVID-19 has been detected in some of the animals also. So we have to be careful of that also. 5 steps to prevent COVID-19. Again, wash your hands properly, avoid touching eyes, nose, and mouth. Stay home, keep social distancing, use face masks always. Antibiotics do not work against coronavirus. Protecting yourself and preventing the spread of the disease. Wash your hand with an alcohol-based sanitizer only. Keep a distance of at least 1 meter between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, your nose, and your mouth. Cover your mouth and your nose with your bent elbow or a tissue when coughing. Seek medical attention if you have difficulty breathing and a high fever. Follow the directions of your national or local health authorities always. Protection measures for people that are in or visited infected areas. Stay home if you do not feel well. even if you feel mild symptoms such as headache, slight fever, and a runny nose. If you need to go out, for example, to buy food or supplies, wear a mask to minimize the risk of infecting others. If you have difficulty breathing and or are at high fever, seek medical advice as soon as possible. Call your provider and inform them of any recent travel, especially to countries with reported cases. How to use a mask. Before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and your nose completely so that any of your sneezes or anybody's other sneezes don't enter your nose. Do not touch your mask while you're wearing it because it could um, get the infection on the mask, get the bacteria on the mask. Replace the mask as soon as it becomes dirty. Dispose the mask actually. Like always remove the mask from behind with the help of the ropes attached to it. Don't touch the mask directly. It will increase the chance of spread of infection. Like how do we handle a patient? Always wear a mask, always wear gloves. PPE is better. Do not touch the patient bare hands. Do not touch droplets. Always practice hand washing. Always clean the surface that patient touch. Take the patient to the nearest medical care. When handling a dead body, use a body bag. Always. Thank you. Thanks a lot.